Hello scholars, my name is Dr. Karis Dillon and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered bipolar II disorder. In this video, we're going to look at cyclothymic disorder, so let's begin. In order to be diagnosed with cyclothymic disorder, the individual has to fit the following criteria. Number 1, an individual has to experience many hypomanic symptoms and times where they have depressive symptoms within a 2-year period, but they don't quite fit the criteria for major depressive episodes or hypomanic episodes. Remember, if we go back to looking at bipolar I and bipolar II, having hypomanic episodes fits in with bipolar II. Having manic episodes fits in with bipolar I. So an individual would have to have some of the symptoms of those, but not fit the criteria for those. 2, the individual will experience the depressive periods and hypomanic symptoms, and they are present for at least half of the time. The individual cannot be without symptoms for more than 2 months in order to be diagnosed with cyclothymic disorder. So of the symptoms that they have, given the depressive symptoms as well as the hypomanic symptoms, they'll have those symptoms for the majority of the time within that 2-year period, but they cannot go for more than 2 months without them in order to be diagnosed with cyclothymic disorder. Number 3, the criteria for a manic episode, a major depressive episode, or a hypomanic episode have never been fulfilled. Remember, if you have one hypomanic episode and depressive symptoms, you fit that criteria for bipolar II disorder. If you have one manic episode and other symptoms, you fit the criteria for bipolar I disorder. Number 4, the symptoms the individual is experiencing are not better explained by a diagnosis of schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other psychotic disorders. Number 5, the symptoms experienced are not because of taking a medication or a substance that induce those symptoms. They also are not experienced because of a medical condition. Now, sometimes different medical conditions can bring about some of these symptoms. So even some medications can do that. So we know that it can't be because of a medical condition or substances that the person has cyclothymic disorder. All right, and lastly, the individual experiences distress because of the symptoms within their social life, meaning their relationship with others, within their career, or in other parts of their life. So they don't just go and label the person or diagnose the person with cyclothymic disorder. The person actually has to have distress because of those symptoms to fit the criteria. The most evident symptom with cyclothymic disorder seems to be an ongoing and fluctuating mood that has some hypomanic symptoms as well as depressive symptoms. The symptoms that are found with hypomanic episodes are not enough or severe enough to be considered a hypomanic episode, and this is why we don't look at bipolar II if they don't quite fit that criteria. The symptoms do not last long enough to be considered a hypomanic episode either. This is the same with depressive symptoms. So we're not quite fitting those, for some of them it was 5 symptoms or 4 symptoms depending. So what is happening with cyclothymic disorder is this is a disorder where they don't have to have so many of those symptoms to fit the criteria of this disorder. The only way that a diagnosis of cyclothymic disorder can be made is if the symptoms for a major depressive episode, a manic episode, or a hypomanic episode have not been met. So again, within a 2-year period, the symptoms must be present for a majority of the time, and the person cannot be symptom-free for more than 2 months if they're going to be diagnosed with cyclothymic disorder. Some persons can actually function well while experiencing symptoms of hypomania. And this is why if a person is going to be diagnosed, they must experience distress because of those symptoms, either in their social life, their career, or other areas because of those symptoms. This disorder is often cyclical, but it's really hard to predict when these mood changes are going to come about. So cyclical means it's going to come back to the person, but it's really unknown of when those kind of mood shifts are going to take place. Those that are impacted by cyclothymic disorder are 0.4 to 1% of the population. Those that end up being seen by a professional because of mood disorder disturbances range from 3 to 5%. So somebody comes in, more often than not, they're going to be seen because of the depressive symptoms versus the other symptoms. So it's very normal for men and women equally to be diagnosed with a disorder. We don't see it affecting more women than men or more men than women. But women do tend to seek treatment more often as compared to men, though. The beginning of cyclothymic disorder usually takes place in adolescence or early adulthood. That's when it will usually develop. The disorder tends to creep up on individuals, becoming more and more persistent as it develops. There's up to a 50% chance a person that is diagnosed with cyclothymic disorder will develop bipolar 1 or bipolar 2 disorder as time goes on. When the symptoms of cyclothymic disorder arise when a person is older, this is when it's really important to take a look at medical conditions like multiple sclerosis, MS, which could mirror symptoms of cyclothymic disorder. Also, checking the thyroid for hypo or hyperthyroidism is also important because some of those symptoms mirror cyclothymic disorder. Those individuals with first-degree relatives that have major depressive disorder, bipolar 1 disorder, or bipolar 2 disorder are more apt to be diagnosed with cyclothymic disorder. There is also a higher risk of those individuals that have cyclothymic disorder to have substance use disorder or sleep disorders. Okay, well, that is the end of the video. I hope that you liked it. I hope that you find it useful. I'm sure cyclothymic disorder is probably one of those that you don't hear about on a regular basis as compared to others. But there is a lot of help out there for anyone that has this or feels that they need this or help for cyclothymic disorder. We have one disorder left for this portion of the DSM-V, and that is substance medication-induced bipolar and related disorder, which will be the next video. So I hope you join me for that once I get that finished. Really going to push hard to get a lot of these out before I go back to school to teach in the fall. So I appreciate everyone, and thank you so much for watching. Bye-bye.